Hi again, everyone, and welcome in to Cincinnati Bengals Talk. I'm James Rapien of allbengals.com. Make sure you hit that subscribe button and ring the bell. And with Joe Burrow going down in practice on Thursday, we have a special guest, Dr. Brandon Bowers at Dr. Brandon Bowers on Twitter. He's a doctor of physical therapy for Athletico. I've talked to you, Brandon, about multiple injuries before, including Burrow when he underwent knee reconstruction surgery a few years ago. I got to be honest, I was hoping to avoid any Burrow injury talk. I think as we all were, and yet we're in this position again. I think he has the worst training camp luck that I've seen, preseason luck that I've seen, and yet it's the best case scenario. I know Jeremy Fowler reported that. I certainly think there's a lot of optimism in the building in general, given how scary it was initially and the disaster scenarios that I think crossed a lot of our viewers' minds. Let's start there. When you saw the first video of Burrow going down, did you think that this was a disastrous, potentially season-ending injury, or did you not go to that extreme like I think a lot of us did?
Anytime you see a player go down like that, especially Joe Burrow, and you think a calf issue, the Achilles tendon also comes into play here. So I think that's where everybody's mind immediately jumps, is the worst case scenario. That's the surgical situation where it's 9 to 12 months before they're back. Obviously, Burrow has an injury history, and he's a coveted piece of this Bengals team. So I think it is easy to make the jump to that worst case scenario. When you go back and you look at the video of Burrow, there's one key piece in that video that we can see, and that's when he flexes his foot downward. You kind of see him move his foot up and down. And if it was an Achilles tendon issue where that thing was torn clean through, he wouldn't have been able to flex his foot downward like he did. So that gave me a little bit of pause early on, thinking that this was just a calf, and was able to steer me away from the worst case scenario. But I know for the fan and others that don't have the medical background that I do, it was definitely a scary situation.
For sure. And there was a lot of doubt. And then you had Zach Taylor say it was a calf. And then I do think that started to take over a bit. So let's talk about it. It is a calf strain. We know that. What exactly is a calf strain? Because it doesn't sound comfortable.
It's really not. Anytime we're dealing with a strain of any muscle, it's an overstretch of the muscle, James. And when we break these down, they're broken down into three categories: a grade 1 strain, a grade 2 strain, and a grade 3 strain. Grade 1 is the least severe, where the muscle's partially overstretched. And when we get all the way to grade 3, the muscle's torn full through, and it's oftentimes a surgical situation. So right now, with the team medical staff, we're trying to discern, and then we'll hopefully eventually release to the public, is the degree of severity here. If this is a grade 1 issue, this is something that he can sit out the rest of the preseason, get treatment, and be pretty darn close to ready by week 1 when they take on the Browns. If it's a grade 2 strain, that's where we get into the partial tearing of the muscle. And typically that's a longer recovery in the neighborhood of 6 to 8 weeks. So right now, just in the evaluation phase, trying to figure out the severity and the course of action. But he certainly dodged a bullet, being that this is not an Achilles tendon issue.
If it is a grade 3 and it requires surgery, and obviously I'm going to the worst case calf strain perspective, what would we be looking at?
I mean, he'd be done for the year. I mean, just putting it straight to you. I mean, it's a long recovery. I mean, now there are anomalies and exceptions to the rules with these things. I think back to Adrian Peterson years ago, who came back from an ACL in 4 months, which is a deviation from the norm. So there's certainly opportunity for that. But if we look at what normally happens, this would be a season ender.
Gotcha. Okay. So, and I don't want to speculate, but basically from what I heard, I don't think they think it's that. So hopefully we can rule that part out. Just so our viewers don't panic again.
No, absolutely. I'm not saying that it's that either. I think this is probably in the neighborhood of a grade 1 or a grade 2. And the key piece with this, James, is you really got to do your due diligence and do this thing right the first time, or else this has a propensity to recur and become a season-long problem. So I'm sure they're going to do just that. They're going to take their time with this thing. There's no need to rush. You know, he's your QB1. He's not going anywhere, and it's a long year. So they'll do things the right way.
Yeah, let's talk about that aspect of it, because I've never dealt with a calf strain. I think probably a lot of our viewers have maybe dealt with hamstrings or other soft tissue type issues like that. Is it the same where you can just re-aggravate it that easy? You feel good, you go out there, you push off, and boom, it happens, and you re-aggravate it. Is it that simple when it comes to a calf strain?
I would say that these calf injuries are a little bit more likely to occur in my experience compared to a hamstring or a quad, just from the sheer amount of force and sheer amount of load that the calf has to take. When guys go to run, jump, and cut, it's super important for that calf to be able to generate that power. Hamstrings and quads are involved in that process, but it's got to come from the calf first.
So we've kind of talked about recovery time. If it's a grade 2, it could be 6 to 8 weeks. The opener against Cleveland is on September 10th, 6 weeks from this Sunday. So it falls sort of in line with that time frame a bit on the early end if it's a grade 2, if he can heal fast. What's next? Is it just rest? What does he have to do initially here to get that calf going in the right direction?
You'll see him shut down for most football activities, would be my guess at this point. And then he's going to hit with some pretty aggressive physical therapy. And what that looks like, number one, is pain control. These can be pretty uncomfortable, even with just walking. So they're going to look to get his pain in check. And then the other thing that happens after you strain a muscle and you overstretch a muscle, it actually has a tendency to tighten back up and become real tense. And so there's a period of time here early on where it's going to be important to help him regain that flexibility with some gentle stretching. And the further he gets removed from the injury, that'll become more aggressive. But making sure that the muscle doesn't become too tight and limit motion longer than it needs to. So pain control and motion here early on. And then as pain subsides, you'll see him progress into a strength phase and then the return to sport and football specific activities phase.
Do you think it's realistic that we see him? I don't think they would risk preseason at all, regardless of the grade, but see him throw footballs in training camp at some point in the month of August?
I think so. I mean, he's not going to see any live practice reps in 11 on 11 or even set foot on the field for a preseason game. But as he gets closer to that return to sport phase, I think we will see him throw footballs on the field just to give him some reps before week 1 rolls around. I don't think that's out of the question.
All right, Brandon, I want to kind of switch gears and ask something that I know a lot of Bengals fans are wondering about. And I noticed that at the start of Thursday's practice, he was wearing a sleeve on that right calf, a compression sleeve, wasn't wearing it on Wednesday. And just full disclosure, I was watching him through warmups and through most of the practice explode off of that leg. It wasn't like he wasn't moving. He was moving in and out of the tackling dummies, pushing off, didn't feel like he was limited at all. Zach Taylor said that some of the guys were sore after day 1, and that might have been why he had that sleeve on there. Well, what is that used for? Is there any reason why fans should see that and say, well, why was he out there to begin with? Because I think some are of that mindset because he had the sleeve on that right calf.
Typically, the sleeves are, like I mentioned, used to help combat soreness and also to help keep muscles warm. It's tough to say here since the team hasn't 100% disclosed if Burrow had some sort of calf issue, which led to him having the sleeve on, but it certainly allows us to kind of go down that path, being that there was no sleeve, he had a sleeve, and then he tweaked that same calf muscle. Long term, I don't think it's going to change his prognosis down the line, but it's just an interesting tidbit that I think a lot of people have picked up on.
So overall, Bengals avoided disaster, Burrow avoided disaster, and there's a decent shot, it sounds like, that he could be ready for week 1. Obviously, we don't have all the details, and I'm not going to hold you to this, but it sounds like there's a pretty decent shot, right?
I think so. And this is going to be something, as with any injury in my clinic or any injury in professional sports, you take things one day at a time. So they'll reevaluate him each day, each week as we get closer to week 1 in that matchup with the Browns and see where things go. From a typical progression standpoint, though, James, I think it's very realistic that he's back week 1. But again, you've got a very talented group, a very talented team with division and Super Bowl aspirations, and they're not going to do anything to jeopardize him here early in the season that has him out for longer than what he needs to be. Realistic for week 1, but I think the Bengals are extra careful if they need to be.
He is Dr. Brandon Bowers. Follow him on Twitter at Dr. Brandon Bowers. And Brandon, I appreciate the time as always. Thanks for coming on.
James, thanks for having me. Always a pleasure.